It is. This is new, Randy. This is my new style. It's October 11th. It's Wednesday, in case those of you who forgot to look at your calendar. Wednesday, October 11th. It's top of the midday hour. You're on Lunch Conversations with Randy and Teddy. For those don't know, I'm Teddy. Look at this bright red shirt. I want to make sure you see me. And our special guest today, we'll introduce you to her in a few moments, is Marissa Michaels. And the conversation today is going to be around health and health in the workspace, bringing healthcare to the workspace, actually. A little bit about me, then I'll have my sidekick, partner in crime, henchman, introduce himself, Randy Wooden, but I'm Teddy. I'm a LinkedIn strategist, trainer, and coach. I teach business professionals how to use LinkedIn as a business tool. I help people figure out how to use it right and not spam people and bother people and waste freaking time using LinkedIn as a business tool. Webinars, seminars, one-on-one coaching, corporate training programs. I'm actually considering hiring a banner to be towed behind an airplane that flies around our heads.
Beautiful.
And it says, it all starts the conversation, but I gotta make some more money, Randy. I need to talk to you about that. Are we good to go, buddy? Are all the ducks in a row?
We are. I'm a highly trained professional, Teddy. I am 100% ready to rock here.
We're not talking about making peanut butter and jelly sandwiches, Randy.
Okay. Hey, Randy Wooden, Goodwill Industries, Northwest North Carolina, director for our professional center. We're based in Winston, but as you may know by now, we have clients across the country, most of them here in the Triad. Again, regardless of age, industry function, that kind of a thing. If you or maybe you know somebody who's in a search, thinking about a search, or been pushed out and it's really time to look, in any event, our services are free. I work with professionals, been doing it forever, it seems like. And golly, now it's been about 3.5 years ago, Teddy and I got together when COVID first hit. And we said, hey, let's have a little fun, do a talk show, whether it's about job hunting, professional development, topics of interest, things that we care about as everyday people walking around. And today's no exception. We're going to learn a little bit more with our guest, Marissa Michaels. But first, I want to make mention that if you have comments or questions, I'm going to monitor the chat box today. So I'll keep an eye on that. And Teddy's going to conduct the interview. And Teddy, again, we get together every single Wednesday. What do we at now? Show 180?
183, man.
Yeah. 183 shows. So we keep coming along. We're booked for another month or two, but we'd like to get some more guests. So if you have ideas for topics or speakers, let us know and get us in touch with them. So Teddy, I'll throw it back to you.
That's 183 people who we have significantly impacted their lives and their businesses, Randy.
I'll go with that.
Yeah.
Sounds good to me.
Yeah. Hey, so again, our special guest today is Marissa Michaels. Marissa is the VP of Employer Solutions for Novant Health, and I think you're in Charlotte. You know what, Marissa, would you say hello to our audience and tell them a little bit about who the heck you are?
Hello, everyone. Thank you so much, Teddy and Randy, for having me today. When you say impacting 183 people, I'm just really hoping that this is like positive impact for me, right? But genuine person, don't do these for a living. And so I appreciate the patience of the audience and being kind to somebody who just kind of cares about healthcare and employers. I am the Vice President of Employer Solutions for Novant Health. I lead a team of people that lean into what the business community needs and wants in terms of workplace health and strategy. And we partner in order to bring those types of strategies from the vast kind of expertise that we have at Novant.
Yeah. Well, there you go. And I also understand you're a Buckeye, and I came down from Ohio as well. So we used to work in the same city, but yeah, I left in 2000. You just more recently came down here, didn't you? I think.
That's right. Yes, I have been in North Carolina now for a little bit over a year and a half. Really enjoy the winters versus the Ohio gray and the gray days. No. But I spent 32 years in Ohio raising a family and really working at a health system and the payer community back in Columbus, Ohio. So
yeah, I hear you.
Miss my friends and whatnot, but I'm really enjoying my time here.
Yeah. Well, I'll tell you, the winters in Columbus aren't well, let's put it this way. One of the things I don't miss about Ohio either. So, hey, you know what? You're passionate about what you do. And I always like to understand the why for our guest. What is it? Was it a series of events? Was it a significant single event? What started you on this path, this passion to do the kind of work that you do?
Sometimes you fall into a career and then you look back and say, I wonder what has drawn me to this career. And so that's sort of the case here. I had a mother who was a small business owner. And, I watched her really try to navigate family and her small business at the time. And then she ended up having a medical trauma that occurred to her. And really, I watched her try to struggle with managing that business, managing her family, and really trying to navigate this really traumatic healthcare event in her life. And as you can imagine, which came last, right? It was herself and managing her own health. And so really, I've been at the intersection of employer and healthcare and bringing healthcare, making it more accessible and affordable for employees and the workforce, really my whole entire career. So I've had a chance to see how it impacts small business. I've had a chance to see how it impacts large business. And I choose this work. Chip Keel on the line would probably say, I don't know why she chooses this work sometimes. It's not always easy, but I really do enjoy being able to make a difference. So.
Yeah, we have a Wolverine fan as an attendee.
I saw that.
You just better be on guard because he'll get under your skin. Those the team up north. Hey, Teddy, let's get it started. There's a lot to talk about, a lot to unpack today with regard to healthcare and in the workplace and the marriage of those two. It's not just about showing up for work, getting a paycheck, going home. Work involves more, and to retain and attract folks, I've got to think that this is a key element for a lot of companies.
So let's go there, Marissa. First of all, help me help the audience understand, what do you mean by workplace health and well-being in the context of what you're doing?
Yeah, broad topic, and I'll try to kind of distill it down a little bit. But for the most part, healthcare is expensive. It's expensive for employers who are insuring their employees. At the same time, it's expensive for all of us who are, hardworking folks. Workplace health and well-being is an employer strategy to help manage not only the spend, but really how they navigate healthcare. So folks like myself and the Novant Health team that I work for really are helping employers develop those strategies in order to better manage the spend, but also just making it more accessible for people who are just hardworking, busy folks, just like, my mom was way back when.
Yeah, I get it. We're gonna dig into that a little bit in the couple different pieces you talked on. I want to bring a thought that you and I talked about earlier up higher into this discussion. Can you explain that you use the word spend, and spend covers, there's two people who are involved in the spend. There's the employer and the employee, because the employee, what's it called? The employee portion of the premium, et cetera, et cetera. What's the difference between self-insured and fully insured business and health insurance?
Yeah, I am by no means an insurance expert, but let me try to explain it in this way. Employers are either self-insured, meaning that their health programs are paid for medical claims out of revenue, right? So they pay dollar for dollar for how they support their workforce. The alternative to that is if you're fully insured, you pay a premium into someone that helps you manage based out of that premium. Regardless of whether you're self-insured or whether you fully insured as an employer, workplace health and well-being is still a strategy regardless. And it doesn't matter to me or us as to what your form of insurance is. It really is about, if you're an employer who wants to take care of your people, it just is really the right thing to do to invest in those sorts of initiatives.
I just wonder if a company is fully insured, then at least they know what their cost is going to be. They're paying a premium. Now, if they're self-insured, then I guess there's more variance, because there is no premium to pay. I mean, ultimately, the company has to foot the bill. Maybe then they reevaluate how they distribute their health care, and maybe the employees have to pay more. But either way, that doesn't really impact you and how you deliver services. So that's good to know. But just wanted to clarify that.
Just understanding where the employer and where his or her consultant or broker might be coming from in terms of how to navigate the services that we may be able to partner upon. But you're right, it does not matter to us.
So,
Gotcha.
so workplace health and well-being, and I like, I mean, to me, they're one and the same, but they're different. Health and well-being. You know, in my mind, Marissa, well-being means, am I doing something that improves my health? That's how this old man thinks about it. So why would an employer want to bring Novant and workplace health initiatives and programs onto campus or into their workspace?
You know, I would say that most employers understand that their workforce is the most important business asset that they have. And so therefore wanting to make sure that their workforce or their employees or their team members are well taken care of and or have access to the things that will better help them engage in a preventative sort of way. So although we say workplace health, well-being is more of a term that says employers are really looking to not just address physical health, but all sorts of things, as you sort of said, Randy, financial health and mental health and all the things that might get in the way of somebody engaging in their well-being or in their preventative type, care.
Yeah. All right, I'm gonna be real stupid with the question because the story behind the answer of this question is important and growing in importance. Why do employers care about their employees' health care? Maybe I told you this, Marissa, a while back when we talked. One of my stupid lines, and everybody on here, I know most of the people who are watching on LinkedIn, and most of the people are in our audience, and they know that I'm pretty satirical sometimes, and I have a little bit of compassion and empathy built into me. But years ago, I'm talking about years ago, I said some dumb thing about a lady who was pregnant and she went off and she didn't come back to work for a while. And I'm like, when did I say her personal life can get in the way of my business? Now I say that because unfortunately, there are employers, few and far between, who feel that way. But the majority of employers that we know about and appreciate their organizations, they care. Why?
Yeah, well, we're just whole people. We're not, it's difficult to separate work and home, right? So if you think about my mom's situation, it was all woven in. And the more likely she was to take care of herself, or employees are to take care of themselves, the more whole they will be when they show up for work. So employers care for lots of different reasons. One of those is it's a spend initiative. And again, if you think about healthcare as a strategic imperative to controlling spend, there's one aspect of it. But the other thing is that you hope that employees stay with you for a while. And so in order to stay with you for a while, they need to see you as someone that cares for them, someone that is bringing opportunity and resources that you may not be able to get on your own. And so therefore, I think there's, it's two things. One, it's a business imperative, but secondly, it's just really doing the right thing by people who just need to come to work whole.
Yeah, I'm with you, Randy.
Yeah, a question for you, and this is not one of the things we talked about in advance. So if you need to punt and get your thoughts together in this thing, but So
Not
here,
gonna blindside you, Marissa, I
well,
promise.
I got to thinking about it because, companies are struggling to attract and retain people. I mean, it's no secret. And healthcare is one of those ways that they can attract and retain folks. But what if we get universal health care where it doesn't matter? You're not necessarily married to your employer to get benefits. I think you can also like if I go from one company to another, I don't necessarily have to start over again with, I don't understand the transportability, but I guess my bigger question is your industry, what you do, dependent upon there still being a need for businesses to kind of be that one-stop place for not only salary, but also for healthcare?
Yeah, that is a pretty meaty comment and question, Randy. But what
You
I
got
will
10
say-
seconds to answer it. Go.
Yes. Okay. Oh my golly.
There you go.
What I will say is that employers are going to need to retain talent, and
Sure.
it is very difficult to attract and retain talent. We all know that workforce development and workforce needs are critically important. So you're right. Not only is this the right thing to do for employees, and or it helps a spend trend, but it also is really almost table stakes for attracting talent. So
Yeah.
things like, subsidizing gym memberships, or making sure that folks have an employee assistance program if they need support during really difficult times, or even, having an on-site clinic in some cases where, an employer can invite people to be seen directly within the workforce, are all things that are now really almost table stakes for larger employers who are competing for talent.
Yeah. So Teddy, when are you going to start, paying my gym membership? Are we going to get around to that, or do I have to wait to the year-end review? Because I really need to lose some weight,
We did your year-end review 3 years ago, and I told you if something changes, I'll let you know. Marissa, that's an interesting perspective of what, if universal health or whatever the term, becomes, ever comes about, it might impact how and who gets access to health care, well-being, and support. But I gotta imagine that the delivery is not going to change so dramatically.
Yeah, I think lots of schools have thought around this, right? And so maybe you have your next topic for podcast on, bringing somebody forward to talk more eloquently about that. But really, certainly the payment methodology might change of, who's covering healthcare, but really the needs of people remain somewhat the same. And so it's organizations like, Novant Health, who really have a obligation to meet the needs of the community, which includes the business community. And that really means listening to what those needs are and evolving with the changing needs.
Yeah. I'm with you. So, one of the things I talk about in the context of employee retention is that employees will keep working for that manager as long as a lot of key things are still being delivered. Like they enjoy the environment, they thrive in the environment, and they're rewarded appropriately for delivering in that environment. And a part of that reward is not only the dollar or the 16 weeks of paid vacation that I get, but it's also, in my mind, but it also is the healthcare. It is the access to that health. And I worked for an organization that we had gym membership, and I loved it back in those days. And then, fast forward throughout the years, I didn't have that. But I can't help but also imagine that there are a lot of people who, if I had the ability to, I use the term go on campus, if I had the ability to go to work and know that right down the hall was a healthcare provider brought to me through my employer, that I could get access to, that's got to be for a lot of people. And I'm going to be very simple and say for a lot of moms who have children, I can't imagine that not being something really enjoyable. What the workplace health programs that you guys get involved in, is that just for the employer or is that for the family?
Yeah, that's a great, Teddy, I'm going to address your comment and your question in kind of in two ways. And, you didn't necessarily ask me this, but I'm going to throw it in there anyway. But if, what is the number one strategy that I would encourage an employer to develop when it comes to workplace health and well-being? It's number one, to just create a culture of caring.
Yeah.
And when it comes to training managers and leaders around that, I think that number one is creating leaders who care about employees and asking questions. It's not about the perks. Yeah. And the perks are always helpful, right? But it doesn't displace or doesn't change the need for people to just create a culture of caring. And then secondarily, I would say that there are employers who offer services directly to employees only based on the plan that they're on. But there are other employers who will open it up to their family members as well as dependents, regardless of whether they're on the plan or not. So I think the moral of the story is no cookie cutter approach to this at all. Every employer is different, and really it doesn't come at the expense of a culture of caring. It's really what is foundational to making sure that a workplace health and well-being program is thriving.
Randy?
I'm gonna back this conversation up a little bit because I'm not sure I'm 100% clear on this, and maybe our listeners aren't either. So, I go see I'm part of the Novant, network of, my providers are Novant.
Thank you, Randy. I appreciate it.
I thought I'd throw that in there. But you're not the only game in town. And so my cohort down the next cubicle, so to speak, may be with Atrium or maybe with Cone or whatever the names of these entities are, because there's a lot of mergers and stuff. Bottom line is, I still want to see my own doctor. So help me really understand. So is it what you guys do? Is it as much education as it is? Because you can't have every doctor that I see at my work site. So what does you guys really provide versus the physical? Hey, I have a sore throat. I gotta go see the doc. I want to get a COVID test or whatever. What do you guys provide? And what's the tangible thing here?
Great question, Randy. And again, let's just distill it down, right? Yep. So first of all, it is a little bit nebulous because it really depends on what the employer's needs are related to the strategy that we're trying to deploy. We're lucky in the state of North Carolina and nearby that we have such rich opportunities to access healthcare, right? So as you mentioned, it doesn't have to be just a Novant Health thing or, another peer's offering. It can be something where people have choice, which is really, the name of the game. But services in particular that employers may deploy from a workplace health and well-being partner include things like we just talked about, an on-site clinic. And they may choose a specific partner for that, but that doesn't mean, Randy, that you can't go see your primary care physician who might be with someone else. Most employers have multiple partners in their sphere, whether that be diabetes prevention program, an employee assistance program, an on-site clinic, executive health to help, support those leaders at the highest aspect of the organization, mobile mammography, occupational medicine. It really, when you think about it, an employer has to be aware of a lot of different things in order to wrap around what employees' needs are. That's not to eliminate your choice, Randy. That's just to make sure that you have the right resources at the right time.
Yeah. So I may not have to go see my family doctor because I have a sore toe. I could go down the hall theoretically if my employer had that, and so I wouldn't have to see my family doctor for it.
Great,
And also,
Oh, go ahead, Randy. I was just going to say there may be lots of instances why your
yeah,
primary care physician is the best navigator of your overall health, but certainly if you stub your toe coming in or out of work or what you're doing on the weekend, an on-site clinic may make it really more convenient for you to be seen and then go on about your day.
yeah, I'm pretty clumsy, so it's either that or trip and fall. Teddy,
That's why we wrap you in bubble wrap.
in
I
bubble
guess,
wrap.
Marissa, that it's there's a plethora of solutions that an employer may want to include into their workplace health and well-being programs, including, by the way, I'm guessing, tell me if I'm right or wrong, telemedicine solutions. It could be on the employer portal for everything that's on that what I used to call the intranet. There could be a button that says call the doctor. And
Yeah, that's a great point, Teddy. Yeah. And really we've certainly seen an increased utilization of that since COVID, right? So prior to COVID, we were smatteringly using virtual and digital methods of interfacing in health, but now certainly since COVID, and because we have so many employers who are have hybrid workforce, some
Right.
people are on site, some people are so many days a week that it's no one size fits all. You really do need to supplement with digital or virtual kind of options. Yeah.
I'm 65, so I have that insurance with that, that big government thing. And my insurance company is regularly telling me that check out everything I have available to me, and including do a telemedicine. They keep telling me they want me to try it out, experiment with it, and I know why they want it. They if I have a need that can be easily answered and solved through the dot, then let's do that, because that's a cost savings. And B, the more they test and practice and experiment, the better it gets. So, yeah.
That's right. We no longer is healthcare, gone are the days where everybody used the emergency department as their place to get things that didn't really require an emergency, right? So innovation has really assisted you, me, and again, thinking back, I wish my mom would have had some of the strategies to engage upon that we have now. We're lucky. We are lucky.
Yeah. Well, I'll let Randy play with and check out the chat. But I want to ask you this question: the difficulty of accessing help. Now, I'm going to be. Here's this 65-year-old guy who has access. I got a hospital across the street from me, Marissa. My own personal hospital across.
They have a bed set aside for him. It's available 24/7. So it's the Teddy wing. Yeah.
And I say that satirically to say I have access to medical care. A lot of us have access to medical easily, but a lot of people don't. Even those who are on employer, insurance programs, it's not easy to access. So help us a little bit, share a little bit about, how is health, I think I'm getting it, but how is workplace health and well-being helping those who are struggled to get to healthcare?
Yeah, well, it's a complicated matter, right? That sometimes there are specialties in the healthcare sphere that are under-resourced just based on the fact that the population has grown, the need or demand for the service has grown. Behavioral health is a classic example of that. And there will never be enough providers in that space to meet the needs. So therefore, there have had to be innovations in those items like virtual health, like digital health, like, those other aspects to sort of unpack and help people gain access to services that are difficult. It's also sometimes difficult to navigate. How do I know where to go? How do I know who's in my plan? And I think that's where an employer can really help guide, be sort of that trusted voice for how to help navigate that. And again, our goal is to employer solutions at Novant Health is really to help an employer help their workforce navigate health.
Yeah. And as your buddy Chip chimed in just now, in his comment, he said, having an on-site clinic that can do some healthcare services absolutely have an employee productivity impact on the positive side. So
Sure.
hang tight. We're 30 minutes bottom of the hour. You're on Lunch Conversations with Randy and Teddy. Our special guest today is Marissa Michaels. Marissa is the VP of Employer Solutions, focused on Novant Health taking healthcare, health and work and well-being initiatives and programs into the workspace. Not an overly new program, but definitely a growing solution that more and more organizations are utilizing for lots of reasons. That's important. I just reminded myself, Marissa, I remember working in factories. I never worked in a factory. I remember going into factories and seeing the company nurse. That's a maybe the same, maybe different. I wonder if back in those days, was the company nurse only there to help me if I cut my finger on the job versus today being to help the whole person.
Yeah, you are actually getting at how I really did get my start. And there were employers many, many years ago, not going to give my age on this particular, public place. But what I would say is, I had the opportunity to see firsthand how companies like GE and Procter & Gamble, who were really forward thinking around workplace health and well-being at the time, kind of lean into how to better support, the workforce. But yeah, it's certainly evolved. It's not just for the large mega jumbo employers anymore. It really is every employer, even small, medium, and large, who really need to develop strategies. All the more reason, right? So if you are a small business and one of your employees is out for an extended period of time or isn't taking care of themselves and can't come to work, in a really strong mind body way, that could be really detrimental to the overall business. So it's not just for the big employer anymore.
Go ahead, Randy.
We had a comment. So your role is in engaging with employers. What about churches, faith organizations, who may have, congregants, but they work for all different companies. So you're not partnering with the companies, but do you partner with organizations to essentially try to work the same plan?
Certainly, as a health system, an integrated health system, we're responsible for making sure we are supporting the community, whether the community be an employer or whether the community be a nursing program for congregations and that sort of thing. So thus really the difficulty of health system and healthcare these days is really trying to meet the needs of evolving and changing communities. Although it is not the unit that I run, certainly there are, entities within Novant Health and others, as your audience is saying, that have developed these type programs to better help people engage.
Yeah. I just thought of a detriment, a problem to this program, Marissa, and it's just flabbergasting me. You know how many people call in I can't come to work today, boss, I'm sick. Now the employer's going to go, well, come on in and see the doctor.
Well, certainly we don't want people showing up when they're sick, right?
You
need time. Yeah, no, I don't. But you need time to take care of yourself. But if you're not sure, if you've let it go too long, or you're not getting the medication that you need to heal quickly, or you're not being able to get into care, that's where the employer can kind of step in and say, let us help you. Not because we want to bring you back kicking and screaming, but at the same time, we want to just make sure that when you're back, you feel better.
Right.
On the other hand, you have many, many employers, and you mentioned the manufacturing environment, who more often than not, what we find is people don't want to miss work because
Because they need it. They need that
they
dollar.
absolutely have to have it. Yeah. So I would say address it early, address it often, and make sure that people are connected to the right access and the right navigational opportunities that an employer can afford them to have. Yeah.
Yep. You know, something that of course I work for Goodwill Northwest North Carolina, and they do a pretty good job of when it comes to my out of pocket, meaning almost nothing or nothing when it comes to preventative care.
Mhm.
And some of the longer term prescriptions. So and so I guess where I'm going with this is, I mean, there's the, oh no, it's happened, now we have to fix it, versus let's deploy a strategy to minimize our health risks and so forth. So some of that's education on the front end and also testing. And then there's also on the back end, slapping a Band-Aid on it and said, don't do it again. Right. So you get both those things. Do you see any trends with businesses one way or the other at this point, or it's just all over the map?
It's, I think from their perspective, it's just a constant balance of benefit design and the ability to make the resources that are needed simple and accessible for people to get a hold of. But really, even there are many people who may have, let's just say, a preventative visit covered at 100%, but still don't find it easy to get connected to someone who can do that for you, right? So it's both. It's this kind of push and pull dynamic item where it's not just about the benefits, it's about bringing resources that are available and make it easier for you to connect upon. Great, Randy, that you have a primary care physician, and I would encourage everyone to make sure you have one long before you need something really catastrophic to support you upon, right? That's the whole goal, is to really to make sure that we are doing all the preventative things we need to, so that we don't kick the can too far down, and then when you have some really traumatic thing happen, that you aren't connected to the right resources and you don't know where to go to get them, and then they become really costly for you.
Yeah, costly for me and for the employer, especially if they are self-insured, if I understand correctly. So yeah, Tenny. Oh, by the way, if you have comments or questions for Marissa, put them in the chat. I'll try to keep an eye on that. Appreciate it.
I'm with you, Marissa. Have your PCP, primary care physician, and I'm lucky that for many years my PCP was a good friend of mine. He actually became a good friend of mine. And so the worst thing, I think, is exactly what you said, I'll echo it, is the worst thing you can have is not have a personal care physician. You got to have that. So just like having
for my dyad partners. So I have a family practice physician who again has been taking care of people on an individual level, has been taking care of employers in the Greensboro market forever, and has recently become kind of my dyad clinical partner to be more of the face around workplace health and well-being from a clinical perspective. So I'll put a selfish plug in for him, and he will be embarrassed that I did that. But Dr. Chan Badger is a new partner of mine to help really bring a face and a light to this and the importance of it. At the same time, Dr. Charles Berger is somebody that leads Novant Health's employee health initiatives on behalf of our 36,000 team members, and he's a tremendous resource for us.
Let's go down that road a little bit. How is Novant Health a little different? What do you guys do that's unique and different in this whole sphere of workspace or workplace health and well-being?
Such a great question, and I knew you were going to ask me that. And I will say some of this is going to sound a little bit trite, but there are a lot of just core offerings that many of us have in our portfolio, because we know that it's critical to a successful workplace health and well-being initiative. Mobile mammography, executive health programs, those sorts of things. So those are consistent. I would say that's the what is it we're offering. I think what differentiates us and what we're really working hard and striving for is the how. It's really leaning in and understand and listening to the unique needs of the employer and their consultants and brokers around what strategies are they trying to innovate around, provide accessibility for, and really trying to navigate on behalf of the workforce. So my favorite partners are those where they come to us and say, do you have this? Can you do this? And my excitement is, let me go back to the vast resources that we have and we're lucky to have at Novant to tap into creating something very unique for an employer based on their needs. So I think it's just trying, really customization.
And the cool thing, I think, and based on this conversation, I'm learning is this is not customizing based on predefined ideas. This is customizing based on, oh my God, we should do that. Oh, why don't we have that? Let's make that happen. I mean, for years, and I'm sure you know this way better than I do, for years, mental health was not a normal conversation with our healthcare providers. Today, I would wager that you could be more clear about this for us. It's a big part of it, and it's an important part of it.
It certainly in my lifetime, Teddy, yeah, that's a great point. Certainly in my lifetime, we only used to talk about physical health, and now we've really been able to say physical health is only an aspect of what we need to do to make sure that people bring their whole selves to work, right? So you're right, mental health has become, is actually one of the number one workplace health and well-being concerns by employers and employees these days. And I think we had a webinar on this yesterday, and our experts were just saying that the most important thing you can do as an employer and an employee is just talk about it. Talk about it with your peers, be open, be vulnerable to sharing that, it's okay to not be okay. There's a statement there. And I think we just have to get comfortable with saying that and then bringing those resources to the table.
Randy?
I have a question. I got to thinking because my mind is always at work, Teddy, all the time. It just never stops.
Look, don't drink so much coffee, Randy.
Always at work. All right. So we're talking. So Novant is big, but you're not in every state in the country. All right.
Yeah.
So you've got a business that says, hey, we'd like to have you partner with us, but they're in the states where you aren't. And are there hurdles? It's one thing, mom and pop down, the huge dynasty that Teddy's amassed in Davie County. I mean, it's a one location thing, so you can deal with the owner, who isn't Teddy, by the way. It's not Teddy. He's the second in charge, or is it third? I don't know. But anyway, what about these big companies that you're dealing with? And they're all over the world. How do you address that as a provider?
Yeah, it is definitely a challenge for a local and a regional health system to partner with an employer who might have, global or multi-state, kind of connections. Here is what I find, though, is that healthcare is a local decision, and it is a local comfort. So the employers who we work with understand the value of making sure that the local health system, regardless of who that is really the trusted brand that they're providing locally. It doesn't mean that the service is necessarily different, but it might mean who's deploying the service in a particular market is different. Now, certainly there are those national vendors who can kind of peanut butter an approach. But again, you kind of are touching on that it rarely works for peanut butter to be able to connect with every individual person. It's like meeting the culture where they are. Every environment is different, and making sure that the accessibility and the resources available are based on where the workforce is living and working.
I think that peanut butter, honey, and banana are global requirements on wheat bread.
This is where at 12:45, after a whole 45 minutes of this conversation, this is where my colleagues probably are like, oh no, she started to talk about peanut butter at this point.
And Teddy just went hook, line, and sinker into
There
it.
you go. There you go.
So,
Yeah.
all right. Health coaching, Marissa. Talk a little bit about that. When we earlier we talked, you shared a little bit about it. How does health coaching play into this, and to help employers help employees?
Yeah, well, health coaching is one of the tools in the toolbox that an employer might lever from, a solution provider like ourselves to really help engage people to meet them where they are. So again, you may have employees who are at different aspects of their journey, and a health coach can be someone that personalizes what's going on in their lives. How do we start to meet you where you are and truly provide that one-on-one personal hand-holding that is often what makes a difference. Teddy, what you need versus what I need are two different things. And a health coach can be really someone that supports us. So I'm going to use a terrible kind of sports analogy, but really, like, you wouldn't have a defensive coach kind of coaching the quarterbacks, right? So it's just one of those things where, and really those individuals are going to lean in, understanding what the individual needs of that person are, and then move them along in the journey that makes sense for that person.
You also, on the back end, I'll call it an advocate, a healthcare advocate. So there's two things I hate in life. Well, at least two things. One is filing insurance claims, and the other is having to deal with taxes. And so insurance claims are a pain in the butt. It's nice to have somebody who can sift through the minutia. Is that also a part of this overall mosaic of all those paperwork that just can choke you? And it's so confusing and frustrating.
Yeah, Randy, great point. I mean, again, many employers will use their broker consultant or their payer to help people navigate kind of benefits and whatnot. Health systems, offer that same sort of thing. But again, an individual health coach may just provide comfort for that individual to say, hey, listen, no, I've verified all that for you, kind of thing. But again, it goes back to just making sure that not just access is provided, but really navigation is provided, right? How do I make sure that I'm comfortable in engaging with taking next steps related to healthcare? Because the last thing you want is a strange or unusual bill that you didn't accommodate as a result of your engagement. So.
Yeah. We also had a question on here about trends and changes that you're seeing maybe 5-10 years out that might change how we look at healthcare.
So that means you have to have your crystal ball, Eddie.
Teddy, you still have your crystal ball?
I do. It's broke. I got to get it fixed, but I still have my crystal ball.
That's in its future.
What I will say is I've been around long enough to see things kind of come back around, right? So it's the focus is the same, but maybe it's gotten more specific around not just, again, let's peanut butter everything, but let's address what's really plaguing our workforce over the next couple of years. How do we, put more focus to our focus kind of thing. But I really appreciate that comment. And I do want to say that, again, I haven't been here all that long, only been here a year and a half. And one of the things that I made sure that I did when I first got here was I spent doing a road show around North Carolina and South Carolina with employers of all sizes. I sat down with their heads of HR or their, safety director, or even in many cases their CFO or COO, and really just asked, what changes do you see since COVID? How can Novant Health be a better partner to you, given kind of what you're focused on now? So I think it's just really, we've got to continue to listen to understand what the changing and evolving needs are. Obviously, hybrid workplace has changed the game of how we deploy care kind of thing. But I appreciate the comment. And I will say this, if I can entertain the question, is most all of the employers that I interface with said the following things. We need a better understanding of how to access healthcare on behalf of our employees. So one of resounding comment. Second was, we are worried about the resources that we provide to our workforce related to mental health, behavioral health, and resiliency. Third was really around, musculoskeletal injuries. And that's really just because we're all aging, we're working real hard, we're sitting at our desks, those sorts of things. So there were very common themes, but as I said, depending on the employer, needs maybe need to be deployed slightly differently. So hopefully that answered your question.
Yeah, and we'll keep seeing that grow. And I think from my perspective, as I get involved in healthcare for aging adult parents and seeing what's going on there, and I'm seeing better solutions than what I saw 20 years ago for that work, for that population of people. Marissa, I remember we always had our doctor offices, we always had our emergency rooms, we always had our specialists. And then you may know when this started, all of a sudden we had urgent care centers, and they just freaking exploded. Urgent care is everywhere.
Yeah.
And they started out in drugstores, and then they pop up in brick and mortar by themselves, and and then they're extensions of Novant and extensions of your peers. And this growth of workplace health is just that next logical step. And there will be another step that comes after that.
Certainly consumerism has changed the way people want to receive goods and services, healthcare being one of those goods and services, right? So it was no longer just acceptable to say, well, we have an ED and we have primary care physicians. It was really like people wanted after hours care, right? And they wanted lower cost alternative care. So you're going to just continue to see kind of evolving changes as consumers want to ingest healthcare differently. And again, I say kudos to those employers for really leaning into that, understanding what their workforce needs are, and then really willing to partner with people who can bring those resources to bear, for them.
And the more we are willing to discuss well-being in a bigger way, i.e. in regards to mental health and behavioral health and aging, our aging, the more we're willing to discuss this, I believe the more likely we will discover more ideas that can help us be better, healthier humans.
I feel for employers, and especially those who have as their job making sure that they're supporting their workforce, right? Like that. And those typically, we call that people and culture at Novant Health, but it could be HR, and Randy, you mentioned SHRM, but again, those folks tend to be the ones that are tasked for understanding what the needs of the workforce are, and then kind of supporting that. But I feel for them, because they they've got to really think about more well-rounded well-being initiatives versus just physical health than they used to in the past, right?
Yeah, focus on the human, not just a part of the human.
That's right.
Yeah. So, Marissa, this is interesting. I'm glad that we got to talk. I'm glad you got to show up and share this whole idea and how it and I really look forward to seeing it grow and grow. I doubt Burriss Consulting will ever have a workplace health initiative. So just don't want to mislead Randy.
Listen, I'm happy to receive a call from anybody. So you just let me know if I can.
His will be sitting on his porch in a rocking chair, reading a book, smoking a cigar, and enjoying adult beverage. That's going to be his relaxation and
all in the
retirement
spirit
plan.
of well-being. I appreciate that.
There you go.
Marissa, if there's one thing, one idea or thought that you want to make sure that our audience leaves with, what is that?
Oh gosh, what a great question. I would say that if you are an employer, it's really, if I had $1 to spend or an advice to give, it really is create a culture of kindness and, connect with someone, from a resource perspective and, just make sure that you're thinking about the needs of your workforce. And then there's a plethora of opportunities for employers and employees out there. It's just continue to ask the question, continue to push the envelope. And you can tell I'm really passionate about this work. I've done it my whole entire life. I'm not doing anything different. And so I just appreciate you both bringing it to the forefront and inviting me today. So.
Good. Well, thank you very much.
Yep.
Hey, Randy, I got a story, dude. Let me tell my
Yeah.
quick little story, and I'll hand it back to you because the next speaker is a good buddy of yours. And I'll tell a story to Marissa for the sake of our audience on LinkedIn and Facebook and YouTube. And here, years ago, my dad was a lifelong employee of a company called, and I just forgot the name of the company. It was an electrical company in Maryland. He was a union worker. And he worked for, I can't remember the name, I just forgot it, a family-owned electrical company. And at one point, my dad fell and he crushed his face at home, not on the job. He fell and crushed his face. Also, 30 years before that, he got burned pretty bad. This employer, electrical company, Truland Electrical was the name of the company in Maryland. When my dad got burned, they made sure that he had no medical costs. He would have had medical costs because it was significant. They made sure he had none. And they also made sure he got paid for nearly 6 months of rehab. By the way, he was the father of 15 kids. I'm number 2 of 15. Years later, he fell and crushed his face and he went to the emergency room. The owners of that company, he was supposed to transition into a bigger job, more pay, but he just got injured and he wasn't going to happen. They came to the hospital and said, we're going to transition you into this bigger job. We're going to give you that pay. And as soon as you're healthy, now they were good friends after 40 years. They said, after you get healthy, you'll come back and work your butt off. But my point is, there was an employer that did not turn their back on that employee. Now, that happens all the time, but I know of at least one incident where it didn't happen. And those are the kind of employers that we want.
That's, Teddy, you said it better than I've said it in the last 50 minutes.
Yeah,
50
your
something.
culture
Yeah,
of kindness is the words that you used.
Yeah.
Randy, what's up, buddy?
Well, yeah, and something we didn't dive into a whole lot, and I'll just throw it out here, not that we're going to elaborate on it, but it's, companies, bottom line, I mean, we're in business to turn a profit. And to do that, like you said at the top, employees are your number one asset. They're also your number one expense. They're at the top of the food chain. So I'm sure that you guys have dissected this thing with employers down to the nth degree about return on investment. So, but I'll just say, aside from the return on investment, it's the right thing to do. Yeah. And because it creates that culture. And how do you know with certainty whether it's the healthcare component that's kept or retained people longer versus paying them more wage? We don't know the detail necessarily, but you're on the right path. Yeah. Hey, by the way, thank you, by the way, Marissa, for coming along. Next week, if you guys are like me, if you're, let's just say, AARP eligible, you remember going to the moon, NASA, remember the great successes and the heroes, these astronauts. You also remember Challenger and other disasters too that NASA has faced. And we also know, we may not know details on it, but NASA and the research they do has led to a ton of developments of things we use in everyday life. And so my college friend, we went to school together, Beth Dickey, she is, I guess, semi-retired now. Beth, I think, is on the call as an attendee, but she works in communications with NASA. And so we're going to get it straight from somebody who's been dealing with NASA for decades and understand where they are now and what are some of their future initiatives. By the way, we're going back to the moon. in case you didn't know that. But we'll learn more next week. Teddy, that's going to be on the 18th.
Yep.
So we hope you'll join us at 11:55. Again, Marissa, thanks for coming in today. We really
Listen,
appreciate it.
yeah. And
Appreciate
Randy, do you think
Eddie?
Beth might tell us where the aliens are?
I don't know.
I'll
She
ask.
may have to shoot you. I don't know if she tells you.
Marissa, again,
Top
thank you
secret.
very much. I appreciate you being here. Chip, thanks for helping make this happen.
Yep. Thank
I
you.
appreciate our audience. We will see you all next week. Bye-bye.
See you now.